The issue that we're talking about today is about fundamental rights, and it is about ending the disgrace, the national disgrace, that the United States of America remains the only major country on earth that does not guarantee health care to our people as a right of citizenship.
Healthcare is a human right.
Healthcare is absolutely a human right, whether you're rich or whether you're poor or whether you are in the middle class. Every person in this country has a right to know that when he or she gets sick, they're not going to face bankruptcy. They're not going to delay going to the doctor because they can't afford the deductible. That they know that they go to the doctor, they go to the hospital when they need to because they are a human being entitled to health care.
That's right.
That's point number one. Point number two, and what we say to our conservative friends who talk about waste every single day, there is no healthcare system in the world that comes close to being as wasteful and bureaucratic as our system. Why are we spending 30% of every healthcare dollar on administration and bureaucracy? We should be putting that money into doctors, into nurses, into disease prevention, into keeping our people healthy.
That's right.
We recently, a couple of months ago, I had the ambassador from Denmark visiting the state of Vermont. They provide health care to all of their people without out-of-pocket expense at 50% of what we are spending when we end up having tens of millions of people uninsured, people paying large co-payments and deductibles. So to our conservative friends, if you want to stop wasting money, let's pass the cost-effective way to provide universal health care to all of our people, and that is through a single-payer system.
I believe that this trend, including many of the steps that have already been taken, is very much against the interests of patients, of physicians, and of other healthcare personnel. The trend toward increasing government involvement in healthcare is not an isolated phenomenon. It is not restricted to healthcare. It is part of a general trend in our society toward replacing voluntary free market arrangements by government control and regulation. It is a trend that is happening all over. It has happened in one industry after another. There is nothing special in this respect about the move to replacing private voluntary medical arrangements with compulsory governmental arrangements. To begin with, a greater involvement of government in medicine may seem to serve the interests of at least the purveyors of medical care by providing an additional source of finance. This is a honey that has led persons in industry after industry to support and promote governmental involvement, which has reacted ultimately against them. I have been impressed again and again with how often businessmen, leaders in various areas, who are very farsighted when it comes to their own activities and to concerns within their enterprises, are very short-sighted when it comes to the area of public policy, and allow themselves to be led by small advantages to foster and favor policies which ultimately redound very much to their disadvantage. In the medical case, the initial inducement is that here is a new source of money, and presumably this is why organized medicine has been schizophrenic about the trend toward government involvement. It has, on the one hand, tended to protest against the move toward socialized medicine. It has, on the other hand, engaged in activities which have promoted that development. When the government is taking over any activity, there is more money available. But what typically happens is once the government has taken it over, the situation changes. There are no more votes to be gotten by taking it over some more. You have to move on to new fields and take over new areas in order to get some new votes. And the result of that is that those areas already taken over get starved. And instead of there being more resources available, there are fewer. In addition to the fact that the ultimate result of a government takeover is less resources, you invariably get lower quality and a lower quantity of medical care.
To answer your question, we spend almost 3 times more per person than the people in the UK, 50% more than the people in France. We can have a world-class healthcare system without waiting lines, spending the same amount of money we're spending right now.
The argument is being made that all of this is necessary because there has somehow been a terrible rise in hospital costs, which the American people either cannot afford or which can somehow be eliminated by wise government bureaucrats. Most of these stories always deal with the benefits that will be received and say nothing about who is going to pay the cost. There is only one source from which the costs can be paid, and that is the American people. The only question is whether they are going to be mediated through bureaucrats with a substantial discount being taken off for cash, or whether they are going to be spent directly by people on their own behalf. So far as the rise in hospital costs, part of it is undesirable and unnecessary. Part of the rise in hospital costs has been a result of the expansion of governmental spending on Medicare and Medicaid, with the result of the many scandals that we have had in this area, and with upward pressure on prices. But in the main, the rise in hospital costs reflects primarily the decisions on the part of millions of American citizens about what they want to buy. It reflects one of the great American innovations, the spread of voluntary, private, hospital and health insurance among the population at large. The major reason for the rise in costs per day of hospital care is not a rise in prices in excess of inflation, not at all. The major reason is an increase in the number and the variety and the complexity of the procedures that are being used, of the tests that are being made, of the services that are being rendered to the American citizen. The costs of hospital care have been going up for exactly the same reason that the amount of monies being spent on automobiles went up during the 19th and 20s and 30s. Because in the main, the public at large has wanted to buy more medical care. And the market has been responding to their demands. The costs have not been rising primarily because hospitals are inefficient. I have no doubt they are. But they've been inefficient all along. There's been no great increase in their inefficiency. The costs of medical care have not been rising because physicians are grasping. Of course, physicians are grasping. So are all of us. We're all of us greedy. But they haven't become more grasping and more greedy. No, the main reason for the rise in costs is because there has been pressure to expand services and provide a different variety. Now, maybe customers have been silly. Maybe they've been foolish in wasting their money in various directions. But I think one of the freedoms we still ought to preserve in this country is the freedom for people to be foolish with their own money. Now, the question is, what is the answer? In the first place, is there any role for government in the medical care field at all? In my opinion, there is no special role for government in the medical care field, with the exception of the public health activities of government where there is a special problem. But I'm now talking about private medical care, about medical care of individuals. I believe there is no special role for government in the medical care field at all.
You got 29 million people in this country who have no health insurance. How's that for rationing? They can't go to the doctor. And then you got even more who are underinsured with high deductibles and high copayments. I have talked to doctors who have told me that people walk in the door extremely sick. And the doctors say, why didn't you come in here 6 months ago when you first felt your symptoms? And people said, I had no health insurance, or I had a high deductible. Chuck, some of those people die or they end up in the hospital. You want to talk about rationing? That's rationing.
I believe that the public at large, in many areas, is beginning to be more sophisticated about what can be accomplished through government, and that the public opinion is there to back it. I say to people who say we have to have government medicine in there, I say, would you mind first telling me which of the other great reforms of government have achieved their objectives? I take it you mean the federal housing program has solved the problem of housing for the low-income groups? I take it you mean that the federal welfare program has solved the problems of welfare and indigence and dependence? That federal urban renewal and housing and reconstruction programs have solved the problem of urban blight? Well, the people, after all, are catching up. So I think it is not entirely hopeless that we can stop this march and turn it back. Thank you.